host ama ni visitor?
What? A clinical officer isn't viable abroad. Vitu kama hizo.
I was told the same thing, and that is a fallacious misnomer, a misconception, and a myth that is not true.
How are you? Welcome to the show. Today I have a visitor in Awino Mireri channel, and let him introduce himself.
Yes, my name is Juguna Michael Jenga. I'm a clinical medicine student at a prestigious institution in Kenya, the only institution under the government of Kenya offering diploma courses and higher diploma. And at this platform, we'll know more about each other and the course that I take and what Awino has prepared for you. Thank you.
Thank you so much for agreeing to the call. Na kukuja kwa show. I really appreciate.
Thank you so much for inviting me. I know your platform is a great platform, and we are going to share our knowledge and see we find a common ground. Yes.
So how did you choose clinical medicine out of all the other courses?
You know, clinical medicine is an interesting course to me. I had not known about it much before high school. Then I found somebody who directed me to the path of clinical medicine. And I did some research. You know, to go into a field you have no idea about, you need to do some research. And I first wanted to know who a clinical officer is. Then I found out that a clinical officer is a gazetted medical officer, qualified and licensed to practice medicine at any health facility. In Kenya, the training is about 3 years for a diploma course. Then the person goes for a 1-year internship after completing your diploma course at any institution you choose, and you do a final qualifying examination. Then you do the clinical officer council exam to get your license, and you go for 3 years apprenticeship under senior medical officer or a senior clinical officer. From there, you can choose to stay employed or choose to go to advance your knowledge. You can do a higher diploma, which is equivalent to a bachelor's degree in general medicine. From there, you can specialize to do pediatrics, whatever you want to do as a specific practice, as a specific unit that you choose to do, you can do. That is how I came to know about clinical medicine, and I have since loved it and I like it so much.
What are the career opportunities available as a clinical medicine student, a diploma in clinical medicine, a clinical officer? What are the career opportunities available? Ulipiga research yote ujue what the options are available?
Yes. Before I did clinical medicine, people walitry to discourage kuniambia ina kazi huku, but I did some research and found out that you can practice general medicine, you can specify, you can be specific, you can take a specific career course in medicine. You can also be a researcher in government organization, in NGOs. You can be a health administrator in the county governments, even in the government of Kenya. There are a lot of career opportunities, and also you can do practice private medicine. You start a clinic, hivyo kidogo, you grow to a hospital. You never know. It all starts with a small step. Those are the career opportunities and the job opportunities that I have researched about.
In our hospital setting in Kenya, what does a clinical officer do? The day-to-day activities and operations of a clinical officer. Able to ambie?
A clinical officer is a quite interesting position in a hospital, because the clinical officer can provide primary health care. That's the first thing. When the first patient comes to contact to any medical officer or any practitioner of any medical field, the first one to be accountable is a clinical officer. And the clinical officer examines the patient, examines what is the problem with this patient, what has happened to this patient. Then he or she does his diagnostics. He prepares a treatment plan, he prepares managing plan. That is normal day to day. They also supervise the approval of patients in hospital, in medical wards, in surgical wards. A clinical officer does that. They also interpret laboratory results. Clinical officer can interpret, not all, but most of the laboratory results a clinical officer can interpret. To some extent, they provide what we call forensic medicine, part of forensic medicine, but not completely. So a bit of forensic medicine, a clinical officer can deal into those issues, and that is as far as I know. There's so much boundaries that a clinical officer can take to. Those are the few I know.
Thank you. So I know you've come across comments like a clinical officer isn't viable abroad, vitu kama hizo, you can't get a job abroad. What do you think about that? Is there anything you can say about that?
Before I started doing clinical medicine, I was told the same thing, and that is a fallacious misnomer, a misconception, and a myth that is not true. For clinical officers have opportunities abroad, but the qualification and the classification of a clinical officer abroad is quite different from here. Clinical officers in Kenya, Malawi, South Sudan, Somali, that is a clinical officer. But abroad, like US and Germany and Canada and Austria, a clinical officer is referred to as a physician assistant. Now, physician assistant is just a clinical officer, but it's a fancy name given to that medical practitioner. So abroad, there are opportunities. Do not be lied to that as long as I know, as long as my information that I have and what I have researched, that there are no opportunities for clinical officers outside the country, that is a lie. That's a complete lie. So there are opportunities outside that just refer to a physical assistants. Yes, physicians assistants.
Now, maybe if you go to salaries, how are salaries? How are they paid? Have you done any research concerning that, both here and outside?
Yes, I have done research, extensive research, and I have seen there are 3 categories in Kenya that give a salary for a clinical officer. We have the first category is the government of Kenya. We have the second category, which is the Ministry of Health. And we have the third category, which is AM Path. So for the government of Kenya, they say the basic monthly salary of a clinical officer is 32,500. The Ministry of Health, they say that the basic salary of a clinical officer in Kenya is 55,000 a month. AM Path, that is the academic model providing access to health care. That is the Moi Uni of School of Medicine and the Moi Teaching Referral Hospital in consultation with the US government, with the Indiana University. They say the basic salary for a clinical officer or for a physician assistant is 71,000. That is in Kenya, 71,000 in Kenya. That is something you can Google it and you will find it. But I know the most interesting thing about medical courses, people want to go abroad. So for physician assistant abroad, they get paid $5,927 a month. That is roughly about 829,360 Kenya shillings, going with the current dollar exchange to Kenya shillings. That is the price, the basic salary here, Kenya, and abroad. Yes.
So, apart from academia, academics, clinical medicine, what other things are you good at outside books?
Outside books, very different from other medical students. You find that people who specialize in medicine, they focus on medicine.
Exactly.
That is true. But for me, I'm quite the opposite. Medicine is a career course, a career pathway. But I am a drama person. I love dramatizing anything and everything. I am a good narrator and a good orator. And I'm a good public speaker. And I love leadership positions, and I love to undertake, those kinds of events that require people to speak, and that is what I love so much, and I like it so much. Public speaking is one of my best qualities.
Hey, I can even see that from
Yes.
the time tuanze kuongea.
Yes.
Hey, you're so good at it, man.
Yes, that is true.
What can you say are your future plans after clearing your diploma? What are you planning to do?
After I'm done with my diploma, for the first, I think 5 years, I will do my internship and in apprenticeship in a government public hospital. I would like to do that, and maybe a senior medical officer, somebody who has experience and who commands the quality of a good clinical officer out of a person. The next 5 years, God willing, I would like to start my own private practice after I've gotten my license and change the world a drop of medicine at a time.
Wow. Napenda hiyo wordplay, jo.
Public speaking is my thing. Yes.
Lastly, advice to your fellow students. Since you're a student, it's 2 years down the line, right?
Yes.
And I guess you've experienced some things here and there. So, and you would like maybe to share things that you've learned to your fellow students, and even those that are maybe planning to join school very soon. Anything that you can say to them?
So, advice to students who are planning to come to clinical medicine, I would like to tell them that clinical medicine is a course that demands total concentration, that it is not such as any other course. It is books and books and books and books and books and books and books. Once you understand that this course demands that you are going to be great, you will study with the aim of not passing your exam, but to become a qualified, licensed medical practitioner. For those who are doing clinical medicine, I will tell them to soldier on. It is the best course anybody can choose, not to be deviated by any comments from any other sector. Yes, do not be deviated. Do not be lied to. You should stay strong and conquer. Clinical officers, we conquer. And that's all I can say. And I'm grateful to be here.
Thank you, Sana.
Yes.
For joining.
Yes.
And willing to be a part of this great thing we are doing. And we really hope that we are going to impact the lives of a lot of students.
Yes.
Those that are planning to join, those that are interested in medicine in one way or another.
That is true.
And I'm really looking forward to us doing a lot of things.
Yes.
So, last comments?
Last comment, I would like to tell the audience of this channel that if it is not this channel, it is not any other channel. This is the only channel that can provide you good, extensive, and well-thorough medical research in any field. That is what Awino will be doing in this channel. Please leave a comment, subscribe, like this channel, follow this person. If you want to gain more medical knowledge, please follow this channel. Thank you.
Vile amesema hivyo, just do that. Na tuta appreciate sana. Thank you for watching. Till next time.